Can play a role in increasing the risk of cancer being passed on from parents to children. At Mercy's Hall-Perrine Cancer Center, oncology genetics experts can help patients and families understand their cancer risks. Joining us this morning is high-risk oncology genetics nurse practitioner Barbara Peterson. Barbara, thanks for being here today.
Thank you for having me.
And Barbara, tell us, what role do you play in helping patients determine their cancer risk?
Well, as a nurse practitioner, I have a unique perspective on this that I can assess not only the patient, but their family members as well to determine their risk, whether or not they need to receive genetic testing or other risk assessment.
And what types of cancer may be tied to inherited risk?
Typically, the ones that are tested more often than not are breast cancer, ovarian, prostate, and pancreatic, but we're doing a lot more research and looking into colorectal cancer and the presence of colon polyps, as that places you at a higher risk for colorectal cancer.
What types of tests are required to determine someone's risk of cancer?
Well, the biggest one that we do, of course, is the genetic test itself. That is a blood sample. We do not like to use the cheek swab or saliva because we can test for more things with the blood specimen. If somebody is not interested in doing a blood test, we can do a high-risk assessment based on their personal diagnosis and their family diagnosis, too.
And I imagine that can be difficult to figure out what to doing with that genetic test result. What are the issues patients face when they learn they carry those cancer genes?
Well, it can be very anxiety-inducing. The biggest thing to keep in mind is that when you go forward with assessing risk and go forward with genetic testing, you have to make sure that you have all of the services in place so you can do something about it. That is really going to alleviate their anxiety more than anything. But we also have now some breast cancer clinics, and we also have a prostate cancer clinic that patients can be referred to, where they can be followed by an oncologist who specializes in breast cancer and also by a urologist who specializes in prostate cancer.
Yeah, having more information is helpful.
Absolutely.
And if a patient is determined to carry the cancer gene, does it affect their insurance?
It can affect their insurance. There is a law that protects patients against discrimination, and it will mostly protect them against medical discrimination. We can guide the patients through the potential for discrimination and help them to mitigate whatever might be coming their way as far as that. The biggest thing to keep in mind is you want to make sure that your insurance are in order before you actually do the genetic test. If you do not have cancer and you show up with a genetic mutation, now you're at a higher risk and it could affect insurance.
Okay, so get all that done before.
Absolutely, yes.
All right, Barbara, thanks for joining us here today.
Thank you so much.
And stay with TV9. We'll be right back.